Basically, what is CFD? What treatments are involved, and what can we expect to see in terms of benefit? So, I'm going to go into a little depth on this because this is a really popular topic and it is very important, and personally very near and dear to me and my family because, we have this, we've treated this in my own family. Um, so, cerebral folate deficiency is CFD. It's defined as any neuropsychiatric or developmental disorder characterized by a decrease in cerebral spinal fluid folate levels that in the presence of normal folate outside of the nervous system. So, basically, it means low folate in the brain, um, but there's actual normal folate in the blood. So, if you test the child for folate, it's going to be normal in the blood, but again, low in the brain. So a definitive diagnosis done for lumbar for CFD would be via a lumbar puncture, and you would basically a procedure to look for the levels specifically in the cerebral spinal fluid. And there are some studies that do this, and they have actually analyzed children with autism and looked at their cerebral spinal fluid. Um, One cause of cerebral spinal fluid deficiency of folate, CFD, are antibodies to both binding and blocking folate receptors that interfere with the function of folate receptor alpha, and that stops the folate basically from crossing the blood-brain barrier. So essentially, the body can make antibodies. There's two kinds, binding and blocking, that prevent folate from getting into the brain. Um, and when they looked at cerebral folate deficiency and autism, folate receptor antibodies, they said, accounted for about 83% of the cases. And mitochondrial dysfunction accounted for 43% of the cases of low folate in the cerebral spinal fluid. So essentially, in autism, you can have low folate in the brain, mostly from these antibodies, but it also can come from mitochondrial dysfunction, so that the folate has to be shuttled into the across the blood-brain barrier. So there are multiple causes of this in autism. And I just like to have people know that even without these positive folate receptor antibodies, cerebral folate deficiency is possible in autism. Um, so a negative test doesn't mean that they have normal folate in the brain necessarily. Um, and just as a general prevalence, they found that in a meta-analysis of 21 studies looking at folate receptor antibodies in autism, they found that folate receptor antibodies are positive in about 71% of kids with autism. So in general, you can just, if you see a child, there's a 70% chance at least that they have these antibodies. If they have autism. And the meta-analysis also showed that children with autism were 19 times more likely to be positive for folate receptor antibodies than a typically developing child without an autism sibling. Um, so 19 times higher is pretty high. So it is a high prevalence specifically for autism. And so it's out there. This is a big deal and it's a big finding. And it could explain a lot of the symptoms related to autism and the comorbidities, such as repetitive behaviors and developmental delays. So what do we do about this? We know it's here. And cerebral folate deficiency can be treated with leucovorin. Now, leucovorin is a prescription medication. It's basically high dose folinic acid. It's an active form of folate. It's very important to know that it's not folic acid, Folic. It is not folic acid. So, folic acid is synthetic and it's in most vitamins and prenatal vitamins and in our food, and it's not going to be helpful. It's not indicated. It's not going to treat these antibodies. So you need an active form such as folinic. It is also different from methylfolate, which is also it can be a supplement. But typically that's not indicated as well because we need a high dose of folinic to cross into basically the blood-brain barrier via secondary type shuttle. So essentially, folinic is the treatment of choice to treat these antibodies. Most trials use a dose of anywhere from zero point 0.5 to 2.5 milligrams per kilogram per day of leucovorin. The most commonly used dose was 2 milligrams per kilogram per day. And then a lot of the newer studies were dosing 50 milligrams twice a day as kind of the higher ceiling dose. And when they're doing on these clinical trials with leucovorin and autism, the trials typically lasted 3 to 4 months in length. So they did find that it was not, a weekly trial. It did need to last at least 12 weeks in length. And there were a couple studies that reported that they needed 1 to 2 years of treatment to achieve the maximal effect. So again, normally when we put kids on leucovorin, it's going to take a few months to take effect, and you're going to want to leave the child on it for a year or two if it's tolerated well, to see if there's any further improvement. Um, and in this meta-analysis of 21 studies looking at autism and cerebral folate deficiency, um, they found that leucovorin improved communication to a medium to large effect size. And what basically that means that there was a medium to large significance in improvement in both receptive language and expressive language. So communication in general was very helpful for. And it also had a large effect size on core autism symptoms such as attention and repetitive behaviors. So again, this was looking at 21 studies with autism and leucovorin. So the whole conglomeration of evidence shows that it is helpful for communication, attention, repetitive behaviors. And there's a study that showed that overall, if they had confirmed cerebral folate deficiency via lumbar puncture and autism, the meta-analysis showed that leucovorin helped with autism symptoms in 67% of children, irritability in 58%, ataxia 88%, pyramidal symptoms 76%, movement disorders and 47%, and epilepsy at 75%. So it can help, a lot of the comorbidity, the movement disorders, the coordination disorders, and even seizures. So again, if I have a child that has autism, and even in the aging, like we mentioned, the aging population, new onset of epilepsy, we may want to make sure that they're on leucovorin. Let's take a look at their folate receptor antibodies. This may help treat some of their seizures in an underlying cause type of way. So it can be very effective, and the studies look very promising. Folate receptor antibody positive children essentially may benefit from this medication. And without having to confirm, cerebral folate deficiency by lumbar puncture. So now when, working in an autism clinic where we treat autism, we're not going to want to get a lumbar puncture on everybody. It is invasive and there's risks involved. So given the safety, we often empirically start leucovorin if these antibodies are positive. And so it typically can be very effective in a lot of my patients. Um, so there's important things to know about this treatment as well. So there is an inverse correlation found between the higher folate receptor antibody titers and lower folate in the cerebral spinal fluid. So essentially, the higher the antibodies, the lower folate they found in the brain in two different studies. So there may be evidence that if the antibodies are higher, we want to dose them a little higher and maybe push that upper limit because they do have lower levels than other children with perhaps lower antibody levels. So you may want to talk to your doctor about dosing based on the severity or the level of antibodies. And a new study actually came out last year showed that MTHFR abnormalities may increase treatment efficacy. So if there's a child that has folate receptor antibodies, and there's MTHFR, those children might respond even better as well. And we know that that's highly prevalent in autism. So this leucovorin, this folinic acid, may actually be treating multiple problems in autism. So there's treating this MTHFR gene mutations and also treating antibodies. As a third way, may actually be helping with the mitochondrial dysfunction. So it can assist in healing in multiple different levels. Um, these antibodies are triggered primarily by cow's milk. Cow's milk will affect the production of folate receptor antibodies. The theory is that milk contains substantial amounts of folate receptors. And so when you drink milk, you drink these folate receptors. the idea is that I've heard from practitioners that if you have intestinal permeability, then these folate receptors from the milk will get into your blood and your blood will make folate receptor antibodies. So, a milk-free diet has been reported to reduce folate receptor antibodies and can improve some symptoms with kids. So, just removing milk may actually reduce these antibodies and reduce the need for leucovorin. Um, but again, we often advocate for both. We should remove milk from the diet and try leucovorin and see how the child responds. Um, in a trial, a 6-month dairy-free diet reduced folate receptor antibodies, and restarting milk actually increased these antibodies again. So again, it can be hard. I have a lot of patients. It's very doable, but refraining from dairy for 6 months was necessary to reduce the antibodies. And again, if there was infractions, then the antibodies may increase again. So the goal would be dairy-free, but also maybe in conjunction with a leucovorin trial, especially if the antibodies are positive. Um, and then another study did find that folate receptor antibodies are intermittently positive in some individuals. So it's important to know that if you do a test and, do the folate receptor antibody test, and it's negative, that doesn't necessarily mean that it was never positive in the past or that it won't be positive in the future. So there is some evidence to suggest that you want to test it what they call on a longitudinal basis. So test it every few years, every couple years to see is it continuing to be high or is it continuing to be negative? And that will help guide treatment as well. So keep that in mind. Also, blocking folate receptor antibodies are associated with reduced thyroid function. So if you test your child for these antibodies, they're positive for blocking. You may also want to make sure that you get a thyroid workup as well, because that can be correlated. And the last question regarding this is, what are the side effects? In a meta-analysis, there were, some adverse effects. Nothing is completely risk-free, but they were generally mild. The most common side effect we saw was excitement or agitation in 11%. So they get a little bit hyper or excited. Aggression was present in 9.5%. Insomnia in 8.5, headache in 4.9, and then increased tantrums in 6.2. So it can be activating for these kids. I do tell parents, to make sure that we have some calming supplements on board before we start it, to minimize side effects. Um, you know, Insomnia can be typically avoided in some kids if we dose it morning, the second dose in the afternoon. So first in the morning, second in the afternoon, as opposed to right before bed. And so, and then again, adding in things like magnesium and omega-3 can help calm children before we add this in, so that they have less side effects. But of course, too, you have to talk to your doctor if you're having any suspicions. I also do, when we prescribe it, we tend to start at a very low dose and titrate it up, increase it slowly over weeks. Um, because there was a study shown that side effects may drop off after about 9 weeks of treatment. So a lot of times kids will get hyper, and then they'll stay like that for 6 to 8, 9 weeks, and then the hyperactivity improves back to baseline. So if you can just increase it slowly, that may mitigate some of these side effects. And if you're having a hard time, I usually back off the dose to a lower dose that was previously tolerated well, and then just kind of ride that out for maybe 6, 8 weeks, and then try and increase it again from there. So there are ways to kind of look at these, but again, talk to your doctor. This is why it's good to have some guidance here. Um, and the next question is this treatment effective in the teen adult years as well? And absolutely. The answer is absolutely. Many children in the clinical trials with leucovorin were actually ages up to 15, 16 years old. So these studies included kids of all ages, even these young adults. There's never really a too late age to start. Um, and again, just make sure that you're doing a decent trial of at least 3 to 4 months, and again, maybe even up to 1 to 2 years to see if you're going to have clinical improvement. And you do in these in the older children and young adults, you want to dose based on weight. So it's basically that means that they're going to need more leucovorin, a higher dose than a younger child would. So again, talk to your doctor about what dose might be appropriate. Um, and then the last question regarding leucovorin is how might it relate to PANS or PANDAS? And I think this is really interesting. This is a brand new study that just came out last year, 2024, by Wells, and it looked at 47 patients with a diagnosis of PANS or PANDAS specifically. And they found that 63% of PANS-PANDAS patients were found to have either blocking or binding antibodies, with the majority of them being positive for folate receptor antibodies, the binding antibodies. So specifically binding for PANS-PANDAS, almost. Um, but it was surprising that ASD was associated with 0.76 lower binding titer. So autism kids actually had lower binding antibodies than the PANS pandas kids did. And then the severe tics with PANS pandas were associated with zero point 0.9 higher binding titer. So the tics, and so these PANS pandas patients, which they're kids, but the age range was 6 to 18 years old, seemed to have higher binding and they were associated with more tics. So it does seem to not just be exclusive to autism. And this can be, again, a cause of cerebral folate deficiency. And going back to the original definition, associated with neuropsychiatric syndromes. So that might include PANS pandas. So essentially, what this means is that if you have a child that has these symptoms of PANS pandas, it's prudent to look at folate receptor antibodies in that situation as well, because that might be an important part of their treatment plan, treating underlying inflammation and infections to resolve their symptoms. So, so very interesting and very important to note.